Participants filled out and returned the VAS assessment questionnaire at baseline and again at 3 months after a single application of the CPET treatment. When looking for an improvement, it is important to distinguish between a small but statistically significant improvement and an improvement large enough to be meaningful to the veterinarian and the pet owner alike. Looking back at the vets who participated in the program, we found a handful that only tried CPET once and elected not to treat a second patient. Interestingly, whether or not a vet decided to stay in the program strongly correlated with the improvement they measured with the VAS in the first case they treated. Vets who saw improvement in lameness score of less than 2 points on the 10-point scale often elected not to treat a second patient. Those who observed improvements greater than 2 points stayed enrolled, even if smaller improvements appeared in patients subsequently treated. Now, we define this 2-point improvement threshold as a compelling improvement, and we use it as a benchmark to assess whether or not a dog experienced a meaningful improvement with CPET. To date, the post-treatment data shows that the CPET treatment can be remarkably effective and suggests 2 important trends. First, young and middle-aged dogs appear to respond better to the CPET treatment than older dogs. 69% of dogs younger than 10 demonstrated compelling improvements using CPET, compared to only 17% of dogs older than 10. Second, dogs with moderate to severe lameness responded better to CPET treatment than dogs with only mild lameness. This is in part an artifact of VAS, as dogs with good pre-treatment scores have less room to improve. If we account for this and only look at dogs with starting VAS scores of 6 or less, one being very lame, we see that 91% of the dogs treated with CPET saw compelling improvements. Now, of course, our data collection is ongoing, and for the latest results, be sure to visit our website. But just as encouraging as these statistical data are the testimonials offered by some of the veterinarians who participated in the CPET pilot and by the pet owners themselves.